Facebook on our Facebook page for people to view. All right, hello and welcome everyone. Thank you so much for joining us today or this evening. And we are, NAMI-NYC is really happy to be able to provide this event to the general public. This is a collaboration between NAMI-NYC and Mindwell. My name is Clara and I am the Public Education Event Coordinator. So I'm going to start by introducing you to NAMI-NYC and going over a couple of logistical details, and then I will turn it over to Dr. Terry Preddy and Dr. Rebecca Berger, who will be our speakers today. As a reminder, again, I'm going to be keeping everyone muted and I'll ask folks to keep their videos off except for the speakers. If you have questions, please put them in the chat box so that you can, I'm sorry, hold on 1 second. Sorry, that was strange and unexpected. I apologize. I got a notification that I was being signed out of Zoom, which would obviously be a very big problem if it happened. So everything seems to be functioning again, but I apologize. Again, if you have questions, please put them in the chat box. We will be addressing them halfway through the presentation. And then again, at the end of the presentation, we're going to be trying to keep questions to those limited periods, since this is quite a big group of people, 93 participants and counting. So we want to make sure that we cover the material that we have prepared. But we do also definitely want to address the questions that people have as they come up. If you are joining us on Facebook, you can also put questions in the comment section on the live stream, and those questions will be relayed to us as well. If you are joining us on Zoom, you can find the chat function at the bottom of your screen if you are on a laptop or a desktop, or on the menu in the bottom right corner of your screen if you are on a smartphone. If you are calling in and do not have access to the chat box, the options are unfortunately a little bit more limited. However, if you have questions after the event, please feel free to email me directly, Clara at ckiley@naminyc.org. Again, that's CKIELY@naminyc.org. The slides for this presentation are also going to be made available. The presenters have generously offered to make those available to anyone who requests them. So you can email me for those as well after the presentation. And I will give my email address again at the end of this little spiel. Do I have any other notes logistically? Okay, I think that's it logistically. So I'm going to very quickly introduce NAMI-NYC and then turn it over to our lovely speakers. So NAMI-NYC, the National Alliance on Mental Illness of New York City's mission is to provide support, education, and advocacy for individuals and families affected by mental illness. That means that we provide free classes, support groups, and other services like this event to anyone who's dealing with a mental health issue or anyone who's supporting someone dealing with a mental health issue. You can find out more about the specific services that we offer by going to NAMI-NYC.org or by calling our helpline at 212-684-3264. I do want to highlight that we are offering almost all of our regular support groups remotely at this time, and you can see a full list of those offerings by, again, going to NAMI-NYC.org and clicking the link that says "We are still here for you." Or again, you can always call our helpline, 212-684-3264. I think that's it. So without further ado, and you can access the recording of this the live stream if you want to share it with a friend or share the information with other people. You can access that recording at our Facebook page at NAMI-NYC and by going to our videos. Okay, I think that is it for real. So I'm going to turn it over to Dr. Rebecca Berger and Dr. Terry Preddy. Dr. Rebecca Berger is a licensed clinical psychologist and the clinical director at Mindwell. Dr. Preddy is also a licensed clinical psychologist at Mindwell. So thank you so much for joining us. Thank you to our presenters, and thank you for joining us.
Great, thanks, Clara. As Clara mentioned, today we'll be presenting on COVID-19 and our mental health. As Clara also mentioned, I'm Dr. Rebecca Berger, and I'm a licensed clinical psychologist and the clinical director at Mindwell NYC. And Dr. Terry Preddy is also a licensed clinical psychologist and a provider at Mindwell NYC, and we are a group private practice located in Manhattan. And currently we are providing all of our services via telemedicine and phone. So just briefly to go over the objectives for our presentation today, we're hoping to increase your understanding about what this pandemic means for both individual and collective mental health. We hope to identify and label mental health symptoms related to COVID-19, to identify specific coping skills to manage the distress associated with these circumstances, to learn how to better engage in self-care as well as to support your loved ones, and to provide available mental health resource information. So we'll be splitting today up into two sections. I'll be providing some general psychoeducation about trauma, COVID, then we'll be breaking for questions, and then Dr. Preddy will be talking about self-care, coping skills, and supporting loved ones. So obviously we all know that the impact of COVID-19 in the US and New York is, unparalleled. For statistics, I am going to leave the United States statistics up here. I'm not going to review them. But in New York State, there are 335,000 confirmed diagnosed cases of COVID-19, 21,478 deaths, and the number recovered is unknown, unfortunately, although there is that information, as you can see, about the United States. The official stay-at-home order began on March 22nd, although I know many of us were staying home prior to that, and currently in effect until May 15th, although we know with staged openings that may be, a longer trajectory, and so we've all been in this for a very long time. First and foremost, this is obviously a medical crisis. However, it's also a mental health crisis. There's been an increased demand for outpatient therapy services, both individual and group. There's been an increase in inpatient hospitalizations, and there's been an increase to helplines and hotlines. SAMHSA runs many helplines, and one of them is the Disaster Distress Helpline, which is specifically aimed to help with the stress prompted by natural disasters, pandemics, and such, and there's been a 38% increase. And there is potential for a stark increase in suicide rates, especially for frontline workers and medical staff. So what is trauma, right? We all hear this word in pop culture and psychology, but let's understand what that really means. So when we're referring to trauma, we're referring to two different types of trauma. There's an individual trauma that refers to a single person or a small group of people experiencing either a life-threatening event or an event that impacts their sense of physical or emotional safety. And examples are listed below, including abuse, assaults, being a victim of a crime, a geographically focused natural disaster, so a tornado or something affecting a town. And then there's collective trauma, and this refers to an event that impacts people on a societal level and shakes their sense of safety and well-being, either directly or indirectly. Examples include war, famine, mass violence, large-scale natural disasters, or national disasters, and of course, pandemics. So what is this thing that we're talking about? What is trauma, right? So trauma is our psychological stress response to something we experience as threatening. And something can be traumatic without it qualifying as a trauma disorder, such as PTSD, right? Oftentimes people think, no, I haven't experienced a trauma because I'm not diagnosed with PTSD. But realistically, we can experience this psychological phenomenon without being diagnosed with a disorder. So feeling traumatized interrupts our sense of safety and typical coping skills. It may impact the way we view ourselves, others, and the world. And the length of time and the severity of impairment in functioning may be diagnosable. So it could be diagnosed as a disorder, but it may just also be a normal psychological response. And the thing is that nobody's presentation looks the same, so it's very important to be mindful of what's happening. Traumatic grief is a topic I'm going to talk about briefly. There are a lot of people either experiencing firsthand or secondhand grief right now, and we can't grieve the way we typically do. And that in and of itself can be considered a trauma, hence the term traumatic grief. So grieving typically occurs with social support and connection. Obviously, with the stay-at-home orders and quarantine, we're in isolation, and that can really compound the distress and loneliness associated with grief. Social connectedness is often a protective factor that buffers against developing a disorder like PTSD. So therefore, the mere lack of connectedness is a risk factor. Humans are social creatures. We naturally want to connect with one another. And there's a lack of active mourning, right? We have these ways we normally grieve, funerals, memorial services, and those things aren't possible right now, and that can be experienced as another loss. And ambiguous loss is happening for everyone, right? So these are the things we don't really have a name for, but we know we're missing. We know the lack of them is impacting our well-being. The pandemic has really highlighted those. It's highlighted our attachments to one another, our routines, and even things like our favorite parks and coffee shops. This type of loss lacks an identified way of grieving or coping, and therefore can feel very confusing. The loss of routine and daily certainty increases mental health distress, especially for those with pre-existing mental health diagnoses. So one thing I want to talk about briefly is how to grieve during COVID-19, right? Just because we can't grieve normally in the ways we typically would doesn't mean we don't need to. Especially for those who've lost someone to COVID-19, it's really important to have that sense of formalized grieving. So ideas include writing a letter to that person, saying what you'd like to say, sending a card to loved ones, planting a tree or a flower in their honor, visiting a special place that maybe you shared with them, of course, being safe, wearing your mask, using social distancing measures, engaging in an activity or tradition you shared with this person, and actively talking about that person with others. And don't be afraid of the painful feelings, right? Sadness, anger, shame, we want to stay away from those. They're really uncomfortable, but the more we avoid them, the more dangerous they become. So allow yourself to feel it. Emotions are a wave, it'll peak, it'll pass, it'll come back, right? But it's very important to allow yourself space to experience it. So COVID-19 is stressful enough, right? The pandemic is stressful enough. And then there are compounding variables that make it even more stressful. Typically, when a person or small group of people does experience a trauma, they still have some variables that remain stable, right? Some things stay the same in their daily life. And in this case, that's not the case. So some compounding variables are financial stress, overexposure to the news, pre-existing medical or health anxiety, technology fatigue, right? We're all looking at screens so often, and connecting with others via technology, computer screens, it impacts our brain differently than it would to connect with people face to face. Isolation, less access to outdoor space, fresh air, and daily re-experiencing of the prompting event, especially for frontline workers, right? We can't avoid this. We're at home all the time because of this. Sometimes having space from trauma or something stressful is really important, and we do not have that space right now. So that's another compounding stressor. So who's most at risk? We're all at risk, but who's most at risk? Frontline medical workers, obviously, physicians, nurses, respiratory therapists, anyone working in the hospital or with patients who are directly affected. Essential workers, the people delivering our mail, our food, people working in pharmacies and supermarkets who have more exposure to other people. Caretakers of someone with COVID-19. Those who have recovered or are recovering and may still be dealing with the stress of that, some of the physical health symptoms related to that. Loved ones of someone lost to COVID-19, those living in isolation, those without financial stability, which is more and more people now, and those with pre-existing medical, or I would like to add mental health conditions. So symptoms of trauma, again, this is symptoms that you're experiencing a very stressful response to something that feels unsafe, not necessarily symptoms of PTSD. So we all have cortisol. Cortisol is the human stress hormone. It's the body's built-in alarm system, and it really helps us function. It helps protect us. However, the longer the body is under stress, the more cortisol it may produce, and cortisol impacts sleep, digestion, heart rate, blood pressure, memory and concentration. So if you've been feeling foggy lately, you've been having a hard time with attention, that's very normal and can be a result of this. And it actually can negatively impact immune function over time. How do I know if I'm experiencing trauma symptoms, right? Like, how do I know something is off? Symptoms can include re-experiencing the event. So that's not just thinking about COVID a lot. You know, a lot of us are doing that. That's sort of thinking about a specific event, a loss, being ill, and re-experiencing it over and over. Increased physical or emotional arousal, increased agitation, nightmares, intense feelings of fear or hopelessness, memory and concentration difficulties, as I mentioned above, inability or difficulty experiencing joy or pleasant emotions, feeling detached from yourself and your loved ones, and an increase in mood swings. And as I mentioned, it is possible to experience trauma symptoms without having a disorder. To be officially diagnosed with a trauma disorder, such as PTSD, symptoms must persist for at least 1 month after the event and span for a minimum of 3 to 6 months. Disorders are diagnosed by how much they impact functioning, right? So if your symptoms are mild and you're functioning well, so you're getting up, you're taking care of yourself, you're making it to work, you're caring for your loved ones, and things are relatively stable, you may just be having a normal psychological response to an abnormal circumstance. But certainly if your functioning is impacted much more than that, you're having trouble functioning, that's a really important time to think about reaching out. And Dr. Preddy is going to be going over that in her section. So research indicates that early intervention leads to improved recovery. So it's very important to identify and try to treat what's going on sooner rather than later. So you want to be mindful of your own experience and the experience of your loved ones, and use the coping skills you already have, right? Somehow, even if the days have been really hard, we've all been making it through somehow or the other, right? That's how we got here today. So you have some skills that are working for you. So keep using those. So a collective experience with individual differences. You may have heard this, I've heard this, right? We're all going through the same thing. This is both true and false, right? So we're all experiencing this unprecedented stressor, uncertainty, etc. However, some of us have less access to support and resources, and that can make the experience much more traumatic, much more stressful. So people who've lost their jobs, people who've lost family members or loved ones, those with compromised physical health, those with mental health conditions who cannot currently access care, those who had less financial resources prior, lacking health insurance, who also couldn't access care, right? So I just want to remind everyone to be kind and patient, and that recognizing that our experience is different than somebody else's can really make a big difference in that person's life. The good news, and there is some good news, is that humans are really resilient and adaptive. And I included one of my favorite quotes to highlight this. They tried to bury us, they didn't know we were seeds, right? So look at evolution. We have gone through wild changes in the past to survive to where we are now. So while this is really difficult, humans truly are adaptive and resilient. The vast majority of us are going to have hard days, but overall we'll maintain our physical and emotional well-being. And even for those struggling, coping skills and support can make a lasting difference in their well-being. You know, and the knowledge you already have, the knowledge you're getting today and other times, share that, right? The more we learn from each other, the more we can support each other. It helps us all to learn and grow. So that's my section, a little bit of information about our psychological well-being overall right now. So we're going to take a few minutes for questions, and then Dr. Preddy is going to take on section 2 of our presentation. Thank you so much.
This is, okay, we have a great question here. Dr. Berger, can you hear me okay?
Yes.
Okay, great. I try to be in bed by 11:30, but I'm up until 1, 2, even 3 a.m. That throws me off every day. What should I do?
I feel, Terry, you or I could answer this. Do you want me to take it?
Go ahead and I'll join in.
Okay. So yeah, that's such a good question. And I think a lot of people are experiencing that right now, right? Like, you know, racing thoughts make it really hard, increased anxiety. Also, being at home more throws off our routine. That can make sleep difficult. So there are a few things I'll add that might be helpful, and Terry can add the rest. So we're doing a lot more things, you know, depending where you are. If you're in New York City in your apartment, right? We're doing a lot more things in our small homes. We're doing a lot more things in our bed, like resting, watching TV, doing work. It's comfortable. The problem is our brain develops an association with our bed as a place that we can do other things than besides sleeping. So when it comes to for time to go to bed, right? Like your brain's like, I don't have to be asleep here. I can be awake here. So I really want to emphasize that it's important to not do other things in your bed during the day other than sleep. The other thing is that if you are in bed for an extended period of time and you're not able to sleep, get out of bed. The sleep research recommends that after about 20 minutes of not being able to sleep, that you get out of bed and go to another quiet, dark place. You can do some, light reading. You can have a cup of decaffeinated tea. You can listen to some soothing music, stay in the dark, avoid your phone, technology, right? The blue light does not help you fall asleep. And then after about 10 minutes, you can get back in bed. It's very annoying because at first you may be getting up like 20 minutes, 10 minutes, 20 minutes, 10 minutes. But over time, that will help repair your relationship with your bed for falling asleep. And a couple other things to be mindful of are just caffeine intake, what time, you're eating your meals. You don't want to be prompting like caffeine and a sugar rush before going to bed. And also try not to go to sleep until you're tired, because I really respect and honor that you want to get enough sleep. But sometimes getting in bed before we're tired can actually make us fall asleep later. And Terry, I'd be happy to hear what you have to add, because I'm sure you have some more to add.
Sure, certainly. And sometimes it's hard to answer questions like this because everybody has different things that affect sleep and interfere with their ability to fall asleep. But another thing that can be really helpful is developing a sleep routine. And what that does is it begins to prepare the body for sleep leading up to actually going to bed. And so what that means is detaching from screens, once again, so that we're not getting that blue light that's going to keep us awake. Trying to avoid any kind of contact with the news leading up to bed, doing things that are going to help relax you, whether that's a warm shower or bath, drinking a cup of decaffeinated tea, listening to soothing music, having different things that help you really relax can be helpful as well. Another thing too is we're really limited in being able to get outside, but to the extent you can be creative, getting some exercise during the day can also help reset us so that we can sleep more soundly at night.
Great question. It looks like we have someone who can't access the chat but has raised their hand to ask a question. So we're going to get to that in 1 second. There's a question from Facebook. I'm out working all day at a nursing home, but when I come home, I feel like I can't relax, even though I'm at home. I think that's a great question. Can you speak to that?
Yeah, I think a lot of people are experiencing stress like this, especially being in a place like a nursing home. I mean, that's working on the front line, and that's being at a place where you're highly vulnerable to potentially catching COVID. So I think the first thing is to recognize what you're doing right now is extraordinary and that this is very stressful. If you're finding that you're having difficulty relaxing when you get home, you might have to experiment with different things. I imagine people in this position are exhausted, and I know my first instinct, a lot of people's first instinct is to turn on the TV, but that doesn't always necessarily work for us or relax us. So it might be that you need to experiment with different things like talking to a loved one, reaching out for support, finding something that you can do with your hands or spend time with your family. Really trying to find things that are going to help soothe you so that you can then recharge for the next day.
Yeah, and I'll add just a couple things. You know, the brain-body connection is so strong. So if part of the reason you're having a hard time relaxing is because your brain is so stressed, you could try some physical things. Those could be a guided meditation, what's called progressive muscle relaxation. So you tense and release each muscle group repeatedly, and a body scan, which is a meditation designed to release stress from your body. So, on YouTube, if you actually put in mindful body scan or progressive muscle relaxation, so many come up. On our website, actually, Mindwell, we also have some of those types of body scans listed. So try to soothe your body if you can't soothe your brain. I think that can be really, really helpful. And there is some research that indicates that repetitive motions, your eyes going back and forth, so sewing, coloring, things like that, actually help to soothe the brain. So you might want to try something like that.
Awesome. So we have 2 questions that have come in via the chat. There is someone who wasn't able to access the chat, but has raised their hand to ask. So I'm gonna unmute Megan, and we'll try this out since it seems like this is the only access she's got for questions. Megan, did you want to ask your question?
No, I think my face just touched the phone.
Oh,
I don't want to ask a question.
great. Okay.
Easy enough.
Amazing. Okay, so our last 2 questions, and then I think we have to move to the next section. There will be another chance for questions after that. Well, we have 2 more. How can, I'm living with PTSD and am a peer specialist working from home. How can I be supportive to my fellow peers without reactivating my own mental health issues?
Mm-hmm. Yeah, so thank you for sharing that. I think that is a really, really good question. I think what's really important here is setting boundaries for yourself, right? And I know Terry is going to go into this a little bit later, but as a helper, you want to caretake for others, you want to help your team, you want to be, a helpful colleague, and some of this may be prompting for you and what you're managing, right? So it's really important where you can to set boundaries. And boundary setting can be done, right, in a really lovely, kind way, right? I see you're struggling. I really want to support you. And, I'd love to try tomorrow. Today, I just can't, right? However much transparency you're willing to share with your team, right? About, I'm having a really hard time right now too. Is there anybody else you can ask, right? So I think using some of that interpersonal effectiveness and setting your own boundaries can be very helpful. I think it's also really important to monitor your own burnout. And what I mean by that is we know we're stressed, right? I can come home and be like, oh, I'm over, or come home, I am home, right? Maybe after a long day of clients, I'm like, oh, I'm overwhelmed, I'm burnt out, but I don't know what that really means, right? So on my team, we try to scale that from 1 to 5, right? Where am I at on that burnout scale today? If I'm a 1, maybe I can do my normal routine and watch TV and support others like I normally would, right? But maybe if I'm a 4, I really need to stop, assess what's working, assess what's not working. I need to do a different routine. Maybe I need to engage in things that are self-soothing. So a bath, essential oils, right? Something distracting like a puzzle or talking to a friend, and reaching out for your own support if you need it. But I really do think that as a helper, setting boundaries and reaching out for support can be especially helpful.
Yeah, absolutely. And then our last question, and then we're gonna we can keep going. And I know there's a couple more questions in the queue, but we can get to those at the end. Tough question. From Facebook? How do you help a friend feel better about the circumstances surrounding the pandemic, such as a small business shutdown, specifically as it relates to suicidal thoughts?
Mm-hmm.
So my first thought regarding this is if a friend's having suicidal thoughts, that might be a time where the friend also really needs to engage a professional as well, because that's a lot for one person to support someone on a day-to-day basis. And, understanding what the person's going through, if it's their own personal business that's shut down, that has huge implications for their family, their finances, and everything else. I think to the extent the person is able, while also making sure they're able to maintain their own mental health, they can provide support, offer a listening ear, see what the person needs as far as like, do they need someone to listen? Do they need someone to help them find ways to cope? And from there, also gently and assertively encourage them to get some professional help too, if their thoughts have become more towards suicide.
Yeah, and to that, I'll add that, you may want to give them resources for them to call or use, and we're actually going to be listing some of those crisis resources at the end of this. I do think if safety is involved, safety always has to be first and foremost. I think in just an interpersonal aspect, right? Like, be really genuine, be like, yeah, that sucks, right? Because it really does suck. And I think that can really help to hear that.
Yeah.
And it does take pressure off of us as listeners to say, what do you need? Do you need help problem solving? Do you just need someone to listen? Because sometimes we put so much pressure on ourselves to solve it, and they might be able to tell us what we need, and that makes the whole thing a lot easier.
Yeah, and I really like Becca's point to validate like how much that really does suck or how terrible it is, because a lot of times it's hard for us to sit and see someone in distress. So we try to think about the future, that things will turn around and things like that. And sometimes that can actually help, or it can lead people to feel a little bit worse. So we want to try to meet the person where they are and just validate their experience before helping.
I know we're going to be talking about the crisis resources at the end, but just a little plug that I want to put out there. People talk a lot about suicide hotlines as a resource for somebody who themselves is having suicidal thoughts or having that kind of sort of crisis. And absolutely, if somebody is in that headspace, it's a great place to go. But it can also be a great resource to know how to better support somebody, even if you're not the one who's kind of in that headspace. It can be a resource for friends and family and loved ones as well. Quick plug.
Great, thank you. Okay, I think we're going to move on to our second section now. Okay, so if everybody will bear with me, I'm just going to switch to share screens. Okay, is everybody still with me? Okay, great. All right, so today I'm going to focus on taking care of ourselves as well as your loved ones during COVID-19, especially in the context of social distancing, since that's changed a lot of the ways that we do cope. So the first thing I want to talk about is attending to personal mental health. And in order to attend to our personal mental health, we really need to be aware of what we're experiencing. We're under so much stress right now that it can be really easy to ignore what emotions we're feeling on a day-to-day basis, what's going on in our body, and more just feel the sense of overwhelm. So some ways to really practice awareness, to get in touch with your feelings, as well as what physical sensations you might be having, include mindfulness practices, the body scan practice, as Becca talked about, as well as giving and receiving feedback to others. So what that looks like is if someone's noticing, hey, you look like you're more stressed than usual, or you look like you might be upset, being okay with hearing that, because what that can do is it can lead you to a place where you are able to take some sort of action. And so that's really what we want to do over time, is build our awareness of what's going on, monitoring changes in ourselves, so that then if we're noticing that we're struggling more or we're getting more burnt out, we can do something about that. And the majority of what I'm going to talk about is what kinds of actions we can take. We've already started to talk about this, but I really want to drive home the point that it's really important to prioritize our own self-care. The reason for that is it allows us to be better caregivers. And if we're not caring for ourselves, it's going to be really hard to care for other people. We hear this all the time. For example, when you get on an airplane, you're always told to please place the mask over your own nose and mouth, before assisting others. This is because if you don't place your own mask on first, you run the risk of losing oxygen and not being able to help not only your family, but yourself as well. And so we're going to talk about ways to prioritize yourself. Okay. So first, I'd like to talk about some basic self-care principles, things that are helpful to people during times like this, particularly during the pandemic. First, we're all out of our own usual routines. And so it's important to try to create some semblance of a routine so that we have some structure to our day-to-day life. All of that's gone right now. We can't stop at our favorite coffee shop every morning. We don't get the train at a certain time. And so we may need to be creative in coming up with a new routine that can maybe give us something to look forward to each day. Now, despite having a new routine, we also really need to remain flexible. That means we don't want to fully schedule ourselves out all day and then feel guilty if we didn't accomplish something, but have a general routine that we can be flexible with. It's also really essential to maintain social connections. When we're feeling isolated, feeling down, sometimes it can be really hard to reach out to others, especially if we feel like we're living the same day every day. But it's important to reach out to our current supporters, maybe even be a time to reach out to people that we just wish we had more time to connect with as well. If you are working from home, it also could be really beneficial to reach out to coworkers. Right now we're feeling isolated. We don't have as much of the ability to talk with our coworkers about day-to-day stresses and what's going on. And so reaching out to coworkers can be helpful as well. Also, it's essential to prioritize right now. People are wearing so many different hats and have so many different stressors on a given day. People might be working, caring for family, maintaining the home, perhaps taking care of loved ones, or even homeschooling too. None of us can do all of these things at once. So it's really important to ask ourselves, what needs to be done right now? And are there things you can let go of? It doesn't mean you need to let go of something completely, but is it essential to get this task done today? Or can something else be prioritized? Could your own coping be prioritized? Additionally, to the extent that you can, limit news consumption. The news fuels anxiety and can also potentially increase feelings of hopelessness. You can limit your news consumption by either limiting how often you check the news or how long you are on news sites. Another thing that can be really helpful is also to use reputable sources. So the Centers for Disease Control website, information from Johns Hopkins, NPR, PBS, BBC, the Associated Press are all really good sources for this. Okay, so I'm going to be talking about first attending to our physical health, because our physical health is so intertwined with our mental health. And we're facing new challenges with regards to taking care of our bodies during this time. The way you can remember this is with an acronym called PLEASE. So we call this PLEASE skills. First of all, treat physical illness. When we're stressed, it's very tempting to work through aches and pains, tempting to work through colds and different things like that. Make sure you're taking care of your body during this time. It's going to make you less vulnerable to emotional distress. Balance your eating. We're all at home, have access to our kitchens all day long, so it's really important for us to fill up on nutritious foods and make sure that we're eating because we're hungry, and rather than we're stressed or trying to fulfill some other need. Avoid mood-altering drugs. There's been a lot of talk that people are drinking more to cope with the pandemic. This does put us at risk. Going through an experience like this, there was an increase in alcohol use post-Katrina. So this is also something to be aware of, is if you are using substances, making sure that you're not using them to cope with emotions. Balancing sleep. We've already talked a little bit about how challenging this in fact can be, but making sure that you're getting enough sleep, making time for sleep, And if you're finding that it's difficult to sleep, trying to find ways to problem solve that, like some of you are today. Finally, get exercise. This is easier said than done given all the stresses that we have, but finding ways to build in 10 to 15 minutes of exercise at home. Also, a lot of people right now are feeling limited in their ability to go outside. So it may be that you need to create some space in your home where you can get some exercise. One potential good thing right now is that a lot of different gyms and companies are offering free access to their apps with exercise videos. So it would be a good time to try out some of those. Okay. The next part of regulating our mood is what we call the ABCs of regulating mood. And so you'll see they each stand for something. Accumulating positive experiences is A. It's really essential to do at least one thing we enjoy each day. That could be reading, cooking a new recipe, practicing a hobby, calling a friend, listening to a podcast. Really anything you enjoy. And it doesn't have to be for a long period of time. You can carve out 15 minutes or 20 minutes to do something like this. But it's really important that we have something that we enjoy and look forward to. For B, we have building mastery. So what this means is we're going to do one thing each day to feel competent and in control of our life. That could involve crossing something off our to-do list, challenging ourselves a little, or working to get a little better at something. So for example, you might clean a room that you've been neglecting, take an online class, or practice a skill that you've been working at. C stands for cope ahead for emotional situations. So what we want to do is we want to think about stressors that might come up in the future, plan for them, and try to decide what skills we're going to use to get through that moment and how to cope with the situation. If we come up with an idea of how we'll cope, we can also end up practicing those skills beforehand so that we can be more effective in the moment. I also want to take a moment to talk about self-compassion. So what is self-compassion? With self-compassion, we give ourselves the same care and kindness that we'd give to a good friend. It's really essential to validate ourselves during this time. We're doing a lot to support others, and we also need to validate what we're going through and care for ourselves right now. It's important to recognize that it's normal to struggle right now. None of us have lived through a pandemic before. We're humans, we're social creatures. We're not made to live in isolation. And nobody can manage this perfectly. We're all carrying so many different hats than we're used to carrying and wearing on particular days. It's very hard to manage all of the responsibilities we now have. One thing that can interfere with self-compassion includes judgments of ourselves and potentially judgments of others as well. Negative judgments can impact our mood and also our well-being. So one way to help with self-compassion is to practice not judging yourself and practicing self-forgiveness. If this is a new concept for you or an area where you feel like you might need some additional help, Dr. Kristen Neff has a great website that I've listed here. And she also offers different self-compassion practices that are helpful for getting you started on being more self-compassionate. So since social media tends to be the one way that we're still able to connect with most of our contacts, I did want to take some time and talk about how to make social media work for you during the pandemic. So first of all, it's important to be mindful of personal social media usage. That means we need to be paying attention to its impact on our mood. So noticing when you're online, when you're on certain networking websites, how you're feeling and how you feel when you get off. With social media comes an increased opportunity for social comparison. And as humans, we tend to look at who's doing better than us, who seems to be managing this better. And that can lead to a lot of negative thoughts. So for this time, you might consider curating your social media experience. And this could involve limiting exposure to triggering accounts, hiding or blocking accounts from your feed. We all know that one or two people that we tend to compare ourselves to that we can begin feeling more negative about. You don't have to permanently block them. Just hide them for this time so that you can be more compassionate towards yourself. Make sure you're following accounts that promote positive feelings. And also consider breaks from social media or limiting your time on social media, depending on how it's working for you and your mood. All right, so we've talked a lot about coping skills for yourself. Now we're going to switch gears and talk a little bit about taking care of others. I really like this quote on this slide. You can't pour from an empty cup. Take care of yourself first. It's really essential to take care of ourselves in order to be a good caregiver. So what are things you can do? You can encourage other people to use coping skills. Some of them might in fact be the same coping skills you're using. Since we all are likely struggling during this time, you can even create a pact with others. Decide what coping skills you're going to use and check on each other. If you're deciding you're going to try to walk twice a week, you and your friend can check in with each other and see if you're able to do it. And if not, what's getting in the way? How can you improve for next time? Also, encourage socialization. Encourage people to reach out to those in their support network. Provide a listening ear and validate their experience. It's okay to say, that really sucks, and to not be able to solve the problem for them. Sometimes people just need to be heard. You can also ask, as we mentioned earlier, what do you need? Do you need me to listen or to help you problem solve? That way you can better help them with exactly what they need. Also really important to make sure that you're managing your own boundaries and that you're encouraging others to reach out to their own mental health providers or to establish care with a mental health provider, particularly if you think that the issues they're struggling with really need professional help, or if you're finding you're not able to manage the stress related to caring for others. Also, please monitor your own caregiving fatigue. Caring for others can be really rewarding, and it can really be exhausting and hard as well. So make sure you're monitoring your own fatigue while caring for others. I did want to go ahead and talk about some creative social distancing ideas. We've all been in this for long enough that we're all bored with being at home and really struggling to be creative. So hopefully there'll be a new idea for you in here. One thing you can do is social distancing walks and picnics. So the ideal way to do this is with people in your house or with friends that you're staying 6 feet apart from and you're wearing masks. You still can have walks and talk and have picnics in this way and keep safe. You can take an online tour of a museum with someone. A lot of the museums in New York now have free online tours. You also can use technology to your advantage. There's a lot of different programs now that have become popular. You can have dinners by Zoom or other media platforms. You can watch shows with your friends using House Party on Netflix. There's a lot of online gaming now, including Jackbox, where you can play with friends from your phone. There's online trivia. You also can get really creative and have an at-home restaurant experience. And this you can go as far as you want with. You know, it can be as simple as having candles and a nice meal to going all out and dressing up and creating menus and really trying to relive a favorite restaurant. If you have young ones at home, or you just happen to be adventurous, you can always do a fort and movie night and create a nice cozy fort and watch a movie with movie snacks. And if you're really limited in your ability to go outside, one thing you can think about is, can you bring outside in any way? Can you add plants to your home, order flowers, or even take tours of national parks online? So an important thing to know is when to reach out for support. As we've talked about, it's normal to struggle during this time, but how exactly do I know if I should be reaching out to a professional or someone else? first of all, if you're experiencing sadness, irritability, anger, anxiety, fear, or hopelessness that won't go away, and it's beginning to interfere with your responsibilities or daily functioning, that's a good indicator that it might be time to reach out to a professional. If you're noticing you're having difficulty performing daily tasks, or you're noticing changes in your basic habits. So this could be sleeping too much or too little, not showering or attending to hygiene, feeling like you're not able to get out of bed, or you're experiencing substantial changes in your appetite. All of these are clues that it's a good time to reach out for support. Before we finish up, I did want to provide a few resources. And if you remember, you're welcome to reach out for our slides if you'd like to have a copy of these resources afterwards. First of all, the American Psychological Association has a pandemic resource site that has a lot of articles and good information. The NAMI helpline can also help with resources, so it can provide information on relevant topics, can help you identify resources in your area. And as they said, they have a lot of online groups right now. So when you can call the helpline, they can help identify potential groups and programs that might be a good fit for you. If through this time you are experiencing a persistent change in symptoms or a change in functioning, some things you can do. Reach out to your current or previous mental health providers. If you don't have one, you also could discuss your concerns with your primary care physician. Most PCPs are meeting with clients by telemedicine right now, so you would likely be able to get an appointment and they can potentially point you in the direction of referrals. You're also able to call your insurance company for a list of covered mental health providers, or you can use the Psychology Today website to find a mental health provider in your area. If you or someone you know is in a crisis, some resources available to you are the National Suicide Prevention Lifeline. We also have the Texas Crisis Line. You can text NAMI or HOME to 741-741, and it's a 24/7 available service. You're also able to text the New York City Crisis Hotline or call. And if your loved one is at imminent risk of hurting themselves, please call 911 or go to your closest emergency department. And so this is the end of section 2, so we'll take some time for some other questions.
Awesome. Thank you so much, Dr. Preddy. So the first question, which has been in the queue for a minute, is what would you recommend for working parents, particularly my child, the question is, my child does not like the idea of having to do so much work at home as opposed to school. Any suggestions or suggestions about balancing working from home and homeschooling?
Yeah, so that's an incredibly difficult challenge. That is a very hard balance. And I have heard from a lot of clients, like, I should be able to do this. Like, I should be able to homeschool my child and also work. And in reality, this is why we have teachers. This is why our kids go to school for a full day, is to get that instruction. If you're having to homeschool your child, it's also likely that you're having to teach as well, because they're not getting the same formalized instruction all the time, despite teachers' best efforts and how hard teachers are working. The first thing I'd like to say is remain flexible and remember what works for your family might not work for all families. So it may take some experimentation to find a good system that works. Also, it may be that less homeschooling is getting done during the week simply because of work, and maybe a little bit does need to be done on the weekends. It's also really helpful to space out times that the children are working and give them breaks, give them time for exercise, different things like that. And it's also important to keep them motivated. Online school is not as reinforcing as being in school. Kids are missing their friends, they're missing end of the year events, they're not getting that same level of quality interaction with their teachers that they care about. And so find ways to be reinforcing to your kids. It might be that they're going to work on this assignment and this assignment, and then they're going to get it to take a break where they're going to get to go for a walk or do something like that. So make sure you're trying to mix it up, all the while knowing that it's also going to depend on your work schedule as well. I think the biggest thing is to be kind to yourself during this time and know that it may be impossible to fully do both at the same time, both homeschool and work a full-time job.
Yeah, I would agree with that. I also want to add, I put this in the chat, but we did actually have a webinar specifically on for parents and guardians of kids in school. So again, if you email me, ckiely@nami-nyc.org, I can share that with you if you want kind of some more detailed suggestions. We also are having an event on mental health for children and adolescents, for family members. It's coming up the day after tomorrow. So if you take a look at our website, you'll be able to register for that as well. It's a quick plug. So we had a couple of questions, additional questions about sleeping. I did want to skip ahead. There's a question that I think hasn't really been addressed and I think is very relevant. Somebody who's struggling with therapy over the phone and video therapy, and particularly feeling like their therapist just isn't paying attention to them. Can you talk about that a little bit? Oh, Rebecca, sorry, you're muted.
Am I unmuted?
Yes.
Great. Okay. First, I just want to say that I'm sorry you're having that experience. That probably feels really invalidating to, feel as though your therapist isn't listening to you over the phone or video, whatever the means is. I think I would recommend a few things. If it is phone and it's hard to feel like your therapist is engaged, I wonder about asking if video is an option, right? You sort of have to be engaged via video the same way you would in person. So if that's an option,
they're using video.
Oh, they're using video. Okay. Okay. Thank you for the clarification. So, finding a therapist is a lot like dating in the sense that it needs to be a good fit. And if you're not feeling heard and you don't feel like your therapist is engaged with you, that may be a sign that the dynamic isn't one that's working for you, right? And while it can be very, very scary to try to give direct feedback to a therapist, we are people, right, who want feedback. We know we make mistakes and we want to do our job better. So if you feel willing, I would try to bring that up and say, I've been having a really hard time engaging in this modality. How could we problem solve that together, right? If you already have a good relationship with them and you don't want to leave that therapist, right? I think it's about problem solving together, collaborating, because if that person has a good relationship with you and they care about you, they'll want to collaborate and try to make the relationship more effective. And if giving, direct feedback isn't helpful and you can't problem solve, that might be a sign that it might be a time to change therapists, right? This is a really weird period of change. Lots of things are changing. And one of those things may also need to be your provider if you're not feeling like you're getting what you need.
One more question that I think is really interesting. What if you find isolation comforting? So lockdown is not stressful, but is feeling anxiety and depression. How can I balance or protect from future relapse when the pandemic is over? Because I think it'll be harder to return to my routine.
So I'm curious what Terry thinks about this as well. I'll put in my 2 cents. I think, first I want to say that's okay, right? Having a break from sort of the hustle and bustle of daily life, some people do find that isolating, right? So the first thing comforting, right? So I would say don't judge your experience. If this is working for you and you're doing okay in this, that's okay too. The thing I would really stress is that patterns of behavior can develop very quickly, right? So let's say you're somebody who prefers to be alone, right? And I obviously don't know the whole picture, but let's say you prefer that, right? And so this time is comforting to you and feels like a nice break, right? That might be reinforcing. And therefore, when things get started again, it's going to be harder and harder to sort of engage in the tasks you used to, right? So it's very easy for behaviors to become routine now. So, you know, being alone a lot, sleeping in, that all may be well and good now. But when this ends, right, it's going to be harder to get back into your routine. So I'd encourage you to do what feels soothing while trying to balance that with mixing that up, right? Maybe you stay in your apartment, you isolate, you know, 5 days a week, but 2 days a week, you put on your mask and you try to go for a walk, right? Or 1 day a week, you commit to calling a friend or Zooming with a family member, right? So that those don't become ingrained patterns that are harder to break after this. So keeping in mind the short-term and long-term benefit of a behavior can be helpful, but everyone finds this experience differently. If you're doing okay, then that's okay too.
Mm-hmm. Yeah, and I think to the extent that you can, once things begin opening up, try to take advantage of whatever transition time we have. I think a lot of us feared that we're going to go from this and then we're going to be back in the office and back to normal everyday life. But if there is a transition period or a period where people are maybe getting back to the office or whatever the situation may be, try to push yourself early to begin doing that so that you can have more time and preparation to getting back to what a normal routine will look like.
So we are a little bit over time, which is okay, but I want to be respectful of people's time. I hope that I got to everyone's question. If I am, as I'm talking, I think we can maybe have time for one more question. So we can, so feel free to sort of pop that in the group chat. If there's any lingering, burning questions that people have, please, again, I'm gonna put my email address in the chat. So if you have something that comes up after the fact, or if you would like to request the slides from this presentation, please feel free to email me. I think there were some additional questions about sleep. I don't want to make you repeat what was kind of already covered, but for those, okay, that's a fair question. Sorry, there was one short question which I think we can get to. But for those folks that had questions about sleep, we did actually have a whole webinar just on insomnia and sleep hygiene, which I think is very relevant to this particular moment. And if you would like the slides from that, please feel free to email me as well. That recording is also on our Facebook page under videos in the same place that the recording of this presentation is going to be. And our last question, which I think is a fun note to end on, is how do you eat at a picnic with a mask on?
Yeah, good question. So we want to also make sure you're keeping 6 feet away. So like we're imagining a spread out picnic, not a very close, intimate picnic. And clearly you would need to be removing the mask in order to eat. But if you're coming within close proximity or anything like that, you want to make sure that you do have that mask on.
Yeah, a socially distanced picnic with, you know, enough space to be comfortable and airflow to be safe. You can remove your mask and enjoy your food. If you don't feel like that's an option, you can also get creative and like lay a blanket out and a picnic basket in your home on your living room floor and, you know, have a makeshift picnic just to get creative.
Yeah.
Awesome. All right, I think a lovely note to end on. I think that's a really lovely note to end on. Again, if there are questions that additional follow-up questions, you can email me, CKIELY@NAMI-NYC.org. And I think with that, we are going to wrap it up. Thank you all so much.
Excuse me.
Yes.
Sorry. Can you put that information up about the hotline for the National Suicide Crisis Hotline and stuff? I was writing it down, but then it went off.
I can actually go back to it right now.
Thank you. Thank you.
There
No
we go.
problem.
Thank you.
Great question.
Thank
And
you.
And if people request the slides too, you'll have information on all the resources as well. So that's another option if you don't have a pin at the moment.
Perfect. All right. Well, thank you again so much, Dr.
you.
Berger and Dr. Petty. Thank you so much to our audience members.
Yeah, thank you everyone for joining.
Thank you.
And yeah, have a good night, everyone. Stay safe and be well.